from Canada, and thank you for the opportunity to promote truth over fear. My name is Dr. Roger Hodkinson, and my presentation to you today is about the most grave injustice ever experienced since Magna Carta. I'm here because this is a defining moment in my medical career and indeed my entire life. It's the fight for freedom and the very preservation of democracy. But first, let me tell you why I feel qualified to address you. I'm a medical specialist in pathology and graduate of Cambridge University, UK. I've had many leadership roles in medicine, both provincially and nationally in Canada, including those as a university teacher, board examiner, and laboratory accreditation inspector. I was previously the president of the Alberta Society of Laboratory Physicians, that means pathologists, and I've been an assistant professor in the Faculty of Medicine at the University of Alberta. I've spent my entire career in evidence-based medicine. I've also been active in public health advocacy for many years as honorary chairman of ASH, Action on Smoking and Health. ASH is the leading non-profit organization in Canada tackling the predatory marketing practices of big tobacco. I say that to document that I have deep, decades-long experience in public health. I'm not an anti-vaxxer or conspiracy theorist. I do not believe that reactions to the COVID pandemic were a simultaneous, coordinated attack on democracy by all of the world's leaders. Such a concept is ludicrous. However, unquestionably, the Great Resetters are taking overt advantage of the opportunity that landed so unexpectedly in their laps. Or as a certain politician in the States said recently, never let a good crisis go to waste. No one is an expert in all the fields involved here. What is desperately needed is for the general public to hear common sense from a reasonably qualified person, and I'd like to think that that's me. So that's why I'm contributing to Truth Over Fear, and I hope my comments prove to be useful. I believe the most important duty in anyone involved in public health is to protect the public from health risks that they cannot effectively manage themselves. In my opinion, during the COVID pandemic, there has been a gross intrusion of government into health matters that could have been perfectly well managed by individual adults, as was the case with all recent pandemics. The degree of this government overreach has resulted in the most profound fear and utterly unwarranted loss of personal freedoms ever witnessed in our entire history. In essence, public health is the practice of medicine at a societal level, and it should follow standard medical ethics where every act is performed for good reason. That is no different from the obligation of an individual physician to his or her patient. Society is, in fact, the patient of public health physicians. In medicine, the primary ethic is the Hippocratic Oath. First, do no harm. But that concept appears to have been totally ignored, as the harmful consequences of these mandates are by any measure grotesquely disproportionate to any of the purported benefits. The cure is far worse than the disease. And that's even accepting the erroneous assumption that all of the so-called COVID deaths are directly due to COVID rather than serious underlying disease. The mandated interventions should have been supported, at the very least, by a consensus in evidence-based medicine that they would be successful. However, all the measures currently being undertaken, including masks, these things, social distancing and closures of all kinds, have no consensus for effectiveness in the medical literature. And in fact, the weight of evidence is heavily against these measures. Masks are, you might say, the very face of this issue, very visible evidence of compliance. The various mandates could only be perceived as arbitrary, knee-jerk reactions by politicians that want to convince the general public that they are doing something. But politics playing medicine is a very dangerous game, and as being played out in this province, in Alberta, shows no signs of abating. Politicians must get their heads around the fact that in 2021, medicine is impotent at controlling the spread of COVID-19 in the general population. The genie is out of the bottle, and we must accept common sense, accommodation, as the only viable approach. Let me state emphatically, nothing works to control the spread of this virus. In my opinion, and many more expert than me, the approach to this pandemic has been wrong-headed from the very inception. As the Great Barrington Declaration eloquently argues, there should have been no change in public policy compared to previous pandemics. Life should not have changed one iota, except for enhanced protection of the vulnerable. The Great Barrington Declaration called that approach focused protection and the only public health intervention that was needed. I firmly support that conclusion. Dr. Bhattacharya, an internationally esteemed epidemiologist from Stanford, said that lockdowns are, quote, the biggest mistake ever made in public health, close quotes. Trying to protect the working world with very low risk of death by shutting down the global economy is ridiculously naive. But let's stop for a moment and address how all this started in the first place. In my opinion, COVID-19 came out of a lab in Wuhan on a pair of dirty shoes, a lab notorious for its poor biosafety record. It got going in Wuhan, but well before anyone knew it was causing a local outbreak, it was on flights to Milan, Italy, where lots of Chinese were used as cheap labor for the leather industry. It caused a large number of deaths in nursing homes in Milan, which is known to have the highest density of older people in all of Europe. Those deaths came to the attention of one Neil Ferguson at Imperial College London, who plugged them into his mathematical models and pronounced to the world that Armageddon was upon us all. Those projections were absurdly distorted, just as they had been with all his previous projections in prior epidemics. Yet no one chose to do due diligence on his projections, and that was the start of the problem. No due diligence was done by anyone. Remember that Ferguson is not a physician or even an epidemiologist. He's in fact a theoretical physicist by training. But no one noticed or cared about the due diligence. All that mattered was the massive threat, and immediate action was demanded by presidents and premiers internationally with one common denominator, that the measures must have one singular characteristic. They must be obvious that something was being done regardless of any effectiveness. The minions came back with measures to please the boss, such as masks and social distancing, knowing full well that they don't work. But that was irrelevant. Their bosses wanted immediate action, and that was all they could propose. And that's how this whole pickle started. Let's fast forward now and consider the actual risk of death from COVID for asymptomatic people who feel no different today from yesterday. Using widely available statistics, for the working well, those under 65, the risk of death is similar or less than previous years with the flu. I ask you, does that warrant shutting down the global economy? No, of course not. It's absolutely mad. And remember that the strength of a healthcare system is only as good as the strength of the underlying economy to support it. In my view, the fear and hysteria over COVID is being maintained by two principal drivers. The first driver is brutal international silencing of all counter-opinions, whether from politicians, journalists, or physicians, particularly physicians, who are seen, I think, as the most reliable source of information for the general public. And the second driver is asymptomatic testing, which is not only useless because of countless false positives, but counterproductive because it drives ongoing public hysteria. Public hysteria, in turn, is being used by politicians to double down on mandates known to be ineffective. You know, if one mask isn't working, we recommend two. Who knows what flip-flop Fauci will recommend next week? 10, perhaps? I attribute the ongoing pandemic over COVID to a litany of failures. Failure of due diligence from the very get-go on the absurd computer modelling produced by Neil Ferguson of Imperial College London, UK. That was the most singular failure, as it became the predicate for similarly exaggerated responses. Failure to inform the general public that there was no consensus in the medical literature for any of the draconian restrictions so arbitrarily introduced. Let's talk about these things first. Masks. The bottom line is they simply don't work. A nanoscale problem cannot be solved with macro-scale solutions. There are only two reasons to wear masks: to protect me from getting COVID from you, and to prevent me giving it to you if indeed I'm sick with it. In prior years with the flu, the CDC and WHO have said emphatically that masks will not stop asymptomatic people getting the flu. So why is it different now? They're both upper respiratory tract infections. And that reality of the failure of asymptomatic people getting the flu, getting COVID, the failure of masks to stop people getting COVID, that was very well confirmed with the best controlled trial that took place in Denmark, and that conclusively nailed the coffin shut. The other reason, of course, to protect you is to protect you getting COVID from me if I have a clinical infection. Well, guess what? In previous flu epidemics, if we knew we were contagious, we stayed home, didn't we? Or we self-quarantined in the new lexicon that's being forced upon us. We took chicken noodle soup. We sprinkled it with Tylenol. We went to bed and sweated it out. We did not need government to tell us. We didn't get any tests until we were admitted to hospital. We didn't visit Granny in her nursing home. And we, the responsible public, decided when we would go back to work without anyone else being involved. It worked beautifully, didn't it? And as you all know, in the process, we gave it the flu in previous years to our family members, not intentionally, but it happened. And that was a good thing, building herd immunity the natural way, with the whole virus, not just a bit of it, and without the need for mandatory vaccination. No masks just don't work. They're virtue signaling or fashion statements. Now let's demolish the idiocy of lockdowns, something never tried before on this scale in the entire history of public health. They have been shown to be, according to Dr. Bhattacharya of Stanford, a world-renowned epidemiologist and co-author of the Great Barrington Declaration, quote, the biggest mistake ever made in public health. I'll repeat that. The biggest mistake ever made in public health. The reason for that statement, recently repeated by Governor DeSantis in Florida, is simply that they have caused infinitely more harm than good and have therefore contravened the most important ethic in medicine: first, do no harm. Failure to report to the general public the cumulative adverse consequences of the interventions on general health care, dying relatives, funerals, weddings, church services, school closures, graduations, and thousands of small business bankruptcies. School closures are worthy of special comment. They have had unconscionable short and long-term effects on educational achievements, emotional development, and vital non-verbal communication. There is no evidence of spread from school children to teachers, none. In my opinion, the teachers' unions are the main responsible party, the culprit, you might say, for the continuation of school closures. I call it a grotesque example of child abuse. Failure to halt the testing of asymptomatic people with PCR-based methods. It should stop immediately, as it generates a large number of false positive results due to largely absurdly high cycle times. That's a technical term. I apologize. It has no medical purpose and maintains public fear unnecessarily. But the consequences go much further than that. Contact tracing can take out 10 times more people out of the workforce than the index case. Imagine for a moment a restaurant, finally, thank you, being allowed to open, and then all the staff have to self-quarantine because of contact tracing, because the chef was the index case. Utter idiocy. The internationally renowned epidemiologists I referred to previously have stated categorically that contact tracing is utterly useless and counterproductive. Failure to use the gold standard of sequencing for identification of COVID-19. The only testing of any kind that should have been done is with DNA sequencing, nucleic acid sequencing by the Sanger method, for which Dr. Sanger was awarded a Nobel Prize. That's how the famous Genome Project was done. That's why it is the gold standard. It could have been easily scaled up for a much lower volume of testing. It was the lower volume of testing that was only needed prior to admission to hospital with COVID-like symptoms. Failure to produce detailed statistical reporting to inform the working well in lay terms about the actual degree of risk from COVID, and that variants were nothing to fear. COVID-19 is an RNA virus, and RNA viruses mutate all the time. That's why there's always a need for a new flu vaccine every year. It's nothing new. So what if a variant is mildly more transmissible? I say that's a good thing, and nothing to ramp up fear even more about. Increased transmissibility means that you give it to more people, which is exactly what we want to happen by natural transmission, and what we have done with great effect in prior flu epidemics. Failure to classify deaths appropriately. The vulnerable population with many comorbidities who happen to be COVID positive at the time of their death are now being classified as deaths directly due to COVID. That is statistical sleight of hand, and very much amplified by hospitals being paid more for COVID care than regular care. Dying with COVID is not the same as dying of COVID. During this pandemic, there has been a remarkable drop in deaths attributed to cancer and heart disease due to obvious misclassification of the cause of death as due to COVID when the real cause lay elsewhere. Let me assure you all, as a pathologist, I'm saying this: lockdowns do not cure cancer. Failure to promote the life-saving potential of vitamin D, which is totally safe, dirt cheap, and has overwhelming evidence of protection from COVID-19. What used to be called the season of coughs and colds is now being recognized as the season of vitamin D deficiency. In a month or so, the sun will come up again, and we will all start making vitamin D in our skin. And guess what? The pandemic will disappear. And then the tyrants in charge will say, "See, we wrestled it to the ground." To which I say, no such thing. It's the classic fallacy trap. Just because B follows A does not mean that A caused B. Failure to inform the public that the vaccines are all strictly experimental, lacking the customary 2 to 4 years adverse event trials, and therefore, in my view, by any definition, unsafe. It's the biggest prospective trial in medical history, and a failure of the second most important medical ethic, informed consent. There was no need for a rushed vaccine in the first place, given the scale of risk for the working well, and in my opinion, its use is profoundly reckless. Indeed, there are concerns now about its safety in women under 50 with microthrombotic problems, which of course proves that point in spades. You can't have it both ways. You can't say it's safe and then recall vaccines because of complications. The vaccine situation, of course, has the potential of getting infinitely worse if so-called vaccine passports come into play. Yes, they'll say, you can refuse the vaccine if you want, but you won't be allowed to travel. What an outrageous restriction of liberty that is. Failure of the expected standard of care from public health physicians promoting the mandates and vaccines. These physicians should be brought to task for contravening two of the fundamental ethics in medicine. First, do no harm, which is contravened with lockdowns, and informed consent, which is contravened with claiming that the COVID vaccines are safe without any qualifying statement. These activities, in my opinion, constitute medical malpractice of the highest order because society consists of millions of people, not just a single patient. And finally, a failure to balance loss of freedoms against the scale of threat. The art of government is in large part about balance. In my opinion, with COVID-19, everyone has got the balance badly wrong. It's all prioritized the containment of COVID over all else. The government's entire focus has been on one virus, ignoring all other measures of health and well-being. Furthermore, the profound loss of freedom resulting from the various mandates are an unforgivable assault on the very essence of our humanity and totally unwarranted given the scale of threat. This is not Ebola. This is not SARS. In fact, Sweden and Florida clearly demonstrate that draconian actions have little impact on the final toll from COVID. Florida is actually doing better than California, despite their radically different approaches to this pandemic. However, even to debate these questions is now stigmatized by government, the media, and professional colleges as irresponsible and to be resolutely suppressed, resulting in a counter-narrative not getting out to the lay public. The entire population has been intimidated thereby into compliance with the threat of outrageous fines and actual jail for disobedience. In my province of Alberta, the encouragement of citizens to snitch on each other is utterly reprehensible. In summary, these numerous failures of government in the COVID pandemic have directly caused the most monstrous loss of freedoms, unwarranted fear, and horrendous personal consequences ever recorded in our province, and all without justifiable cause. The same applies to every other jurisdiction internationally. It must end now and never be allowed to happen again. The general public must never again have their rights so trampled on, while we are perfectly capable of managing this type of problem ourselves, independent of any government intervention, as we have done so effectively in years gone by. This pandemic has taught us three powerful lessons. Firstly, that this virus was probably created by genetic engineering in the Wuhan lab by what is called gain-of-function research. This is the bizarre concept that by intentionally making a virus more infectious, better treatments might be discovered. Dr. Fauci appears to have intentionally bypassed President Obama's prohibition of this type of research by outsourcing the research through a white-gloved intermediary to the lab in Wuhan. So in many respects, this should not be called the China virus, but more appropriately, perhaps, the USA virus. But that's all besides the point. The fact that gain-of-function research is still going on internationally is a cause for greater degree of concern than nuclear war. This type of research is not rocket science. If some rogue state wanted to develop it as a bioterrorism weapon, it could be an existential threat to humanity, making COVID-19 look like a walk in the park. The second major lesson is the belated realization of the massive dependence we have on Chinese manufactured pharmaceuticals for all areas of medicine. That, of course, led President Trump to start the repatriation of as much manufacturing as possible from China to the USA. The rationale is simple. You don't feed your future enemy. The final lesson is how much money this pandemic has cost the world in terms of supporting all the mandates. The ballooning of national debts has been on a gigantic scale, never seen before, never outside of wartime. The borrowed monies will all have to be repaid by our children for years to come, with a combination of increased taxes, reduced public services, and likely currency devaluation. The Chinese are loving this self-imposed impoverishment. So I repeat in closing, nothing works to stop the spread of this virus through society. Nothing could work, nothing did work, and nothing will work. This virus must just be allowed to run its course. The governments of the world must simply accommodate to medicine's impotence and allow the public to use its abundant common sense to protect the vulnerable. As someone very famous once said, it's all been much about nothing. Or in the idiom of recent American politics, it's a nothing burger. Thank you very much for your attention. Goodbye from Canada. And let's see truth over fear. Goodbye.